We're going to begin our case studies in the decriminalization of substance use with Portugal, which has kind of a fascinating history in this area. So traditionally, Portugal has been the gateway for drugs entering Europe. The majority of the cocaine, heroin, and cannabis that has entered the European market has entered through this relatively medium to small size European country, Portugal, on the furthest southwest part of the continent. And despite its status as a gateway country, the prevalence of drug use in Portugal is historically very low. The lifetime prevalence in 2001 was 7.8%. Now, contrast that with the United States, where the lifetime prevalence of cocaine use alone is double that. So, drug use in Portugal is very low compared to other Western countries. But there are a high prevalence among these drug users. There's a high prevalence of injection heroin users. And because there's a high prevalence of injection heroin users, there's high rates of HIV, hepatitis B and C, and tuberculosis among the drug use population. And actually, it's so high that they have the highest rate of drug-related AIDS cases in the entire European Union. Now, it's not the greatest number of total cases because the country is small and there's a low prevalence, just the highest rate among their drug users of drug-related AIDS cases. Now, importantly, at this time, prior to 2001, there was a growing consensus that the criminalization of drug use, that the punishments that were being put on those in possession and distribution of these substances, was actually hindering their fight to prevent these infections. It was actually part of the problem, not a solution. So the judicial system was not actually helping the secondary epidemics of infectious diseases among the drug-using population. So in 1998, there was this expert committee that was formed, and their final recommendation was to decriminalize all illicit drugs for personal use. You couldn't sell them for profit. You couldn't use them to make money, but you can use all illicit drugs for personal use based on this recommendation. And 3 years later, this recommendation became law. Drug use, rather than a felony, a jail sentence, became an administrative offense. Anyone caught in Portugal consuming an illicit drug is now referred to the Commissions for Dissuasion of Drug Addiction, the CDTs, in that title. I love the title, the Dissuasion of Drug Addiction. And they're referred here instead of the criminal justice system. It's kind of a diversion program for people caught possessing and using illicit drugs. And these CDTs have two aims. The primary aim is to dissuade drug use and encourage dependent users into treatment. The primary aim of the CDTs is not punishment. It's not dissuade. I mean, it's not. Let's just keep it simple. The primary purpose of the CDTs is not punishment. It's trying to help the person. It's trying them to not become dependent, and if they are dependent, to try to help them to quit the substance. The secondary aim is when they apply punitive sanctions. So essentially, if a person does not complete the treatment protocols, does not follow the advice of the CDTs under the primary aim, then they're authorized to apply punitive sanctions. And another important aspect of this is there actually isn't really much of a judicial presence on these CDTs. Each CDT consists of 3 people. One person is a social worker, one is a medical professional, whether that's a physician, a nurse, anybody in the field with a high enough degree, and then one lawyer. So you have actually more people on the health and public health side and the medicine side than you do the legal judicial side. Now, what were the effects of this? Because that's very important. It's very rare for an entire country to legalize illicit substances. Well, Table 2 over on the left side of the screen, that details the change in 12-month prevalence among adults for various types of illicit substances. Now, at first glance, it doesn't look too great. The prevalence of any illicit substance use and the prevalence of any of these other specific types of substances essentially increased from 2001 to 2007. So in the 5 or 6 years between when the law was passed and when the final measurements were taken. But compare that to the 2 tables over on the right. The table on the left is Portugal, tables on the right, table 3 and 4. The top one is for Spain over the same period of time. The bottom one is Italy over the same period of time in the same the age demographics for those years. In Spain, we saw increases in hashish and cocaine. There were decreases in ecstasy and amphetamines. In Italy, we saw increases of all types of illicit substances. So the prevalence of illicit drug use may have increased in Portugal in the short term, but it really wasn't any difference from the nearby countries, Spain and Italy, which are very close. Spain is the border for Portugal. It kind of mirrored the changes that were going on in other countries in Europe at the time. And this graph tells a very similar picture. Instead of focusing on adults, this is focusing on teenagers, 15 and 16-year-olds to be specific. Portugal are the three columns over to the left. Italy are the three columns in the middle. The rest of the European Union as a whole are off to the right. Each column is a different year where the measurements were taken, and there really aren't any significant differences in the lifetime prevalence of illicit drug use among the students in Portugal compared to the rest of the EU or to Italy. If anything, the drug use rates have gone down. The prevalence has gone down even further, particularly for ecstasy. So we don't necessarily see this. We definitely don't see this big uptick, abnormally high uptick in substance use due to the passage of this law. If anything, the substance use in Portugal is simply following the trends of the rest of the EU. And then finally, here we have, in terms of short-term effects, these are the number of drug-related deaths recorded in Portugal, Spain, and Italy from 96 to 2008. Overall, now it's a little weird because Italy is that small dashed line, but it's on a different axis. So Portugal and Italy don't actually have the same drug-related deaths, but Portugal actually has lower drug-related deaths than Spain. It does actually have lower drug-related deaths than Italy. There may have been a sharp uptick in 2006, 7, 8, but we don't have the further years out, so we don't know if that's a trend or an aberration. And again, there doesn't seem to be any significant difference between the experience in Portugal with this complete decriminalization scheme and Spain and Italy where these substances were still illegal. How about some longer term effects, some more years out? So these data were taken from the European Drug Report in 2017, so essentially 15, 16 years out from the passage of this law. This map is the last year prevalence of cocaine use among young adults. And if you look at Portugal down in the lower left-hand part of this map, it's light green. It's actually one of the lowest prevalence rates of cocaine use among the European Union. And that's particularly striking because Spain, right next door, actually has some of the highest rates of cocaine use among the entire European Union. So again, there doesn't seem to be this large sustained spike in drug use just due to this law. And we see something similar, although maybe not as striking, in terms of high-risk opioid use. Now, Portugal was battling high-risk opioid use before the passage of this law with a lot of injection drug users. But here, Portugal is kind of middle of the pack. They may still have a large number of people for that country using injection drugs and being a high-risk opioid user, but they're certainly not in the top tier. Countries like France, the UK, Italy, Austria all have higher rates of high-risk opioid use compared to Portugal, despite Portugal both decriminalizing the drug use and these other countries having it remain completely prohibited.